So hi everybody, you join me on a glorious day here at St Mary's, and I just wanted to have a few minutes with you just to say how people keep asking me how am I feeling about the impending CQC visit, and I thought, yeah, I know everyone's wondering how are we all feeling. I'm asking you as well, how are you feeling? And I think I said to somebody earlier this morning, I've got really mixed emotions. I'm really delighted that the CQC are coming because I know how much this organisation has improved over the last few years. I'm particularly so proud of what you've all done and the work that you keep on doing to really serve our community well, not just to please the CQC. And I know the CQC don't want us to do it just for the CQC either. They want us to really be able to provide excellent care to those that need our services. And also they want us to be an organisation where we all feel proud and happy to work. Again, you all know my feelings. The better we can make this organisation for you and for all our staff, got the ducks joining in with me now, the better we can all feel about the place and the contributions we make, then the better outcomes we'll have for our patients and our community. So we've got less than 3 weeks now to the CQC joining us, and I just talked to you a little bit about the practicalities. So yeah, mixed emotions. I'm excited for the CQC to come and see what we've done. I'm also nervous, and I know many of you are as well. And until the visit's over and we hear what they've had to say, I think having those butterflies in my tummy and a rush of adrenaline when I know they're on site, I think is just natural for all of us, because the visit is really important to us. It's so important that our community have trust and faith and confidence when they come here for their care. And I absolutely believe that the work that you do deserves that recognition. So what we've been told by the CQC is that please don't feel anxious when they're here. Please just be yourselves, be honest, and have good dialogue with them. Tell them of the things that you've done and that you're proud of. And if there is areas that concern you and you feel that they're not being addressed by the trust, then yeah, or by all means share with them what you feel you need to. So the CQC want you to be honest. They want you to feel that you can approach them, and most of all they want to see what improvements we've made since their last visit. We know on the first day of the visit there'll be around about 40 inspectors, which is an awful lot of people, and as I say, I have some butterflies in my tummy when I think about 40 people being here in our organisation, which, as we all know, is relatively small. So we start off with 40 people, and by day 3 that will have reduced, or if all goes well, that will have reduced. Those inspectors that are on site will be supported by people doing telephone calls to people, and there'll be MS Teams calls as well. So 40 on site, but behind the scenes further CQC colleagues will be talking to other staff as well. So they will be visiting all areas, nothing's off limits to them. Currently, we know that they will be in the acute services, so if you work in acute, then you could expect to see them. Even if you had a visit last time and it went well, if they have a line of inquiry that links with your service, then they could still arrive. They will also be in our mental health services, and they will be in community services as well. I can't tell you how many people and exactly how much time and who they want to speak to. All of that isn't disclosed to us until the visit begins. But to be honest, if you are prepared and you are just transparent and you are confident, then you've got absolutely nothing to worry about. People say to me, "Oh, I don't want to let you down, Maggie, and I don't want to let the trust down." Believe me, none of you will let me down. I just want you to be as open as you are with me and with each other, and I'll be proud of all of you. It's not easy for any of us when we're having interviews with inspectors. We feel nervous, and we sometimes get tongue-tied and we forget the key messages that we've been trying to convey. But just be yourself, be honest. If you don't know something, say I don't know, I can come back to you with the answer or the evidence. Don't try to make it up to improvise, just be as honest as you can. So the visit will be 3 days, and we will get some feedback, not as in the old days, pre-COVID, we would get feedback on that on the Thursday afternoon. I don't think that will happen this time because of social distancing. So it's likely that it will be the Friday or the following week before I know what their initial conclusions are. And as soon as I have had those conversations, I'll do another video clip like this. During the 3 days, if the CQC find anything that they feel is critically unsafe or needs addressing urgently, they will come and they will tell me, and we'll be able to feed that back to you immediately. I know sometimes in the past we've heard things several weeks later, and that's never great. But I do hope that the CQC colleagues who will be with us this time will pass us timely information. So I'd like to say that if you don't hear back on the day or as soon after the day, then things have gone okay. However, if I hear 3 or 4 days or a week later that they've got concerns, I'll let you know just as soon as I know. So finally, I just want you to think about the 5 questions that we've been talking to you about, so that you can really be prepared for when those inspectors arrive. We've done an awful lot of our own internal reviews, and I can tell you the feedback that I keep on receiving is really positive. And thank you that when you do have those visits and there's things that we can see that can be put right, just for how speedily you've all taken that on board. So the 5 questions are really important, and if you can just take a few minutes to read each question and then consider how you would answer a CQC inspector if they ask you in your area while they're here what's changed. And very finally from me is, just be prepared. It's really important visit for us. Be honest, but be proud of the achievements. I particularly would like us to come out with outstanding for caring, because that's what I see from all of you. Really outstanding care for those that you look after. So I'll be back in touch just as soon as the visit's over.